All right, in the airway and breathing course here, the other lesson in the support tactics unit, we covered gastric tubes. Now we're doing ET tube suctioning. This is part of your registry airway skill station, so if for no other reason you want to know that. There's a couple of different ways to do this out in the field. There's the open technique where you're trying to maintain sterile technique and do sterile suction, and that's the one the registry wants you to use. And then the even better if is that closed suction setup where that catheter is contained within a little plastic sleeve that's just shown on the right there, and you don't have to worry with the sterile technique thing in the field. And those work great, but I've been really unable to convince most services that I've worked for and worked with to go that route. They kind of insist on using the open catheter technique for whatever reason. And honestly, I just don't think that we do this very well. I don't think we do this in the field as much as we should. And when we do, I'm not sure we're using sterile technique. So we want to teach you the right way. We want to show you a very cool way to do it. And we want you to be sure to focus on this because it is part of that registry airway skill station. When you're doing the sterile thing, you need to open the end of the package and get your suction hooked up before you don that sterile glove. You want one sterile glove and one not, and you want to kind of treat it like you would. Hold that glove up, that sterile glove, and make sure you're not touching anything. And then you use your sterile hand to grab the end of the suction catheter that goes in the ET tube, and you're going to insert it into the end of the ET tube, and then apply suction as you withdraw. You apply suction by covering the thumb valve just like you do with a yanker tip or other things, and then twirling the catheter in your fingers really makes a difference and helps you really suction and clean out the inside of that ET tube. Then you either toss that catheter and get you another one, or you do the even crazier thing of trying to save something in a semi-sterile manner that's already been down in the tracheal tube. But again, this is lab practice stuff. We want to integrate it in once you've got a bunch of other things figured out, and so that you, when you get to that part in your airway station at the registry skills exam, and the examiner says there are secretions in the tube, then you're ready to manage the secretions in the tube. So that's ET tube suctioning.